Hey, what's up guys? John Fox here with Take Charge Health and Wellness and Fox Sports Training. I'm going to piggyback today something that I did on the shoulder instability video that I gave the other day. We're going to talk a little bit about frozen shoulder. I have a friend of a friend that reached out and asked me if I could do something to help them out. Frozen shoulder, also known as adhesive capsulitis, is a very unique situation. Most of the time it's an idiopathic disease, means it comes on for really no reason at all. You can get it after surgery or prolonged immobilization in a sling, things like that. But for the most part, it's a systemic inflammatory disease that really nobody understands real well and why it comes on. It does come on more prominent in women between the ages of 40 and 65 is the most common window of period of time and the most common demographic to get that. It's, like I said, it's very unique, and what happens is you go through three basic stages. There's a freezing, frozen, and thawing stage. And in the early stages, the freezing stage, that can last anywhere from 4 months to 6 months to even up to a year. And that's when things are getting worse and worse and worse. Basically, the beginning of it is, like I said, it's an inflammatory condition, and the joint capsule around the shoulder just starts to get more thickened, adhere, and become kind of contracted. It becomes in like a fibrotic stage, and the tissue just gets really thickened and kind of contracts to itself. I drew a little picture here. I'm not an artist, but basically this is supposed to be the shoulder joint. That's the humerus. This is the shoulder blade itself, and this little dotted thing is the capsule. Well, it has a little lip to it here, so as we lift the arm up in the air, it can expand kind of like an accordion. Well, imagine if the accordion little pages got glued together and stuck to this part here, so it just kind of adheres and sticks to itself, and the capsule gets just kind of fibrotic and holds itself down, and it just doesn't allow a lot of motion. Particularly abduction and external rotation are affected. So you get this limited external rotation and abduction. It's really hard to get up and wash your hair. It's really difficult to reach behind your back and strap your bra if you're a female, or kind of itch your back or whatever if you're not. So those are the most common things you see, especially early on in that freezing stage. Things just get worse and worse. It starts out as like a dull, achy pain, and then you just notice your shoulder just stops moving more and more and becomes tighter and tighter. That's the freezing stage. There's really not much you can do. In fact, I encourage you not to really force it or try to do too much in that stage. While that's going on, you really want to just treat it with anti-inflammatories. So ibuprofen or naproxen are good. Always see your doctor and make sure it's safe to take those things. But yeah, just trying to reduce the inflammation. You can use heat and ice in combination. Gentle stretching. One of the main things I would do in the first stage is just some pendulum exercises, and just try to let that dangle. You'll notice that it gets kind of contracted and people get like this. It's really stiff and it's hard to just relax. So one of the first things you can do is just kind of find an area and just let that arm hang and try to dangle it and let it free swing and do circles, and just try to get it to let go a little bit in that first stage. The second stage is the frozen stage. That's when things kind of just aren't, they're not getting worse, but they're not really getting better. And again, that can be a really long phase as well. It can last anywhere from 4 to 6 to 10 to even up to 2 years. You can kind of just, people complain about it. And I found in that stage, I don't do a whole lot either. That's when I would start doing some physical therapy, see your therapist. They can do some ultrasound. They can get in there and start doing some manual therapy, some joint mobilization. You can get a little bit more aggressive with your stretching, and I'll show you a few stretches at the end that you can do passively for that. But basically, it's just a real gradually stiffened stage. It stays really tight, and the more you crank on it, the worse it gets and the more inflamed it gets. So in that frozen stage, I kind of like to just stay real mellow and not do too much in that stage either. It's not really just a tight joint, it's a systemic condition. So the more you crank on it is not the answer. It's, in fact, probably the worst thing you can do is crank on it in those early stages. We talk about stage 3 now. That's the thawing stage. Things start to loosen up. You start to feel a little bit better. It's less sore, it's less inflamed, and you're starting to see a little bit more improvement in range of motion. That's when you attack it. It's funny because I did my research on this, and I got pretty good at treating these, but I would have people come to me after they've already seen a whole bunch of people and they're gone through the freezing and frozen stage. Now they're coming to me in the thawing stage, and things are just going to start naturally getting better anyway. And I started having a lot of success with them, so I was, I got some credit that I maybe not necessarily do, but I'll take it. So yeah, in that third phase, that's when things can really start to make a difference, and that's when you really start to try to treat it and be more aggressive with your range of motion, the joint mobilizations, prolonged stretching, In that second stage, towards the third stage, at the end of the second stage, as you start to feel a little bit better, I like to get in the pool and maybe start doing some water therapy, just getting in underwater and making circles with your arms, try to move it back and forth. You can do some isometrics early on where you try to push it against the wall, but it doesn't go anywhere. You're not actually trying to strengthen it, you're just trying to make it contract a little bit and relax. And so sometimes you'll see you can kind of push here and get it to contract, and then as you relax, maybe try to go a little bit further and do this stretch a little bit more and more each time you go. Another exercise I like to do is called the table slide. This is one you can do early on. So if it was in my left shoulder per se, you find like here, grab something that slides and just gradually lean forward, hold, keep your head down. And as you get better and better, you can go more and more. And that's a passive stretch. That's a passive stretch, and you can just kind of passively get range of motion that way versus trying to lift it on your own, because you're going to see that shoulder blade is just stuck. One of the early things you can do is just really work on posture and trying to get the shoulder blades pinched and do shoulder blade like shrugs and retraction. You want to get the shoulder blade to come back and down as you lift up, and the therapist can work on that with you as you go. So getting in the pool towards the end of that second phase, and definitely in the third phase, you can start trying to swim, even if it's in shallow water and you walk and just try to kind of swim. You can do like some breaststroke, just start moving that shoulder more and more. So you want to move it more once it gets into that thawing stage, and that can be anywhere from early on, 4 or 5 months, or it could be even up to like 2 years down the road. But the worst thing you can do is while it's in that inflamed stage is crank on it and crank on it. Pause. Okay, so yeah, we talked about the table slides. One of the other things you can do, you can take a towel and work on towel stretch. This again, in the third phase, as things start to loosen up, you just grab it with the other hand and gradually pull up, kind of hold it for a little bit, let it stretch, relax, and then try to go a little bit further each time and get a little more motion as you go. And you want to be able to get up, where you were before, ideally. And that's a good one that you can do. Wall walks. So as you get into that third phase, you can start changing it from table slides, which are passive, and you can start trying to do more active and just climb up the wall with your fingers. And as you get to a certain point, you can kind of hold it there and stretch. Just everything's real gentle, you don't crank on it, and you really want to try to keep your shoulder from being up here. You're trying to stay down here. If you start to see this, then just come down, maybe stay where you are and try to really force that shoulder blade back down and not force the arm up, but work that shoulder blade. You want to have the shoulder blade come down and back as you try to lift that arm up. Awesome. All right, so now I'm just going to show you a couple passive things that you can do early on, maybe in the first and second stage. Showing you some laying down, but I want to talk about some goals. The goals are to decrease inflammation and gradually increase range of motion without increasing pain. Last resort, you can see your orthopedic, you should be seeing your orthopedic anyway, but they might tell you that they'll try a cortisone shot. I haven't had a lot of success with those, especially early on. Towards the end, it might be a little beneficial. That's something for you and your doctor to discuss, but that's an option. What I really would say to everybody out there to try to avoid, and again, unless your orthopedic surgeon feels really good about it and you really trust your orthopedic surgeon, avoid manipulation under anesthesia. That's where they put you asleep and then they just crank on it, and it'll get the motion back, but I noticed that it hurts, and so as soon as they come out, they want to go right back to this position. It kind of sets you backwards a little bit sometimes. So that's something to think about. I would try to avoid that at all costs, but that's a discussion for you and your surgeon. I'm going to show you something here on the bed real quick. So when you're in bed and you want to increase range of motion, so let's say it's my right shoulder, something I like to do, you want to be able to get to here, that's our goal, but you're not going to be able to do that early on. So let's say you're stuck here. I like putting something back here and just letting this fall into it. But you don't want to put, like I see people put weights in their hand and try to let it go, but you're gonna fight that. So if you want to put some weight or something in your hand and let it go back, that's fine. But make sure you have something behind your arm that you can feel like it's not just floating in air and you can relax into. So you're just kind of just laying like this. This will be hard for somebody with frozen shoulder to get to here. They're gonna be here. So you might even have to get like this and just let it fall to here. But the idea is to let it be passive. Try to let this relax into what you're falling. So hanging here in no man's land, you're not gonna be able to relax. You're gonna be kind of fighting it. So I really encourage you to put something behind, and then you can even push back against it and relax. And as you feel like you're getting better, you can just make whatever it is behind you lower and lower, and then just let it relax gradually. Let gravity kind of help you get there gradually. But that's the motion you want to get back, is this abduction and external rotation. That's what's usually limited the most. So those are some basic things that you can do. I talked about things with a band, so you can, as things get better and you get down the road, you can start doing a little bit of active range of motion or resistive range of motion with external rotation and just kind of pinching the shoulder blades back. You can always do your rows, putting this around and pulling like we were doing the other day on the other video, and trying to do some of those shoulder rows. Again, we can do, let's just do this real quick. So like I said, we can do rows. So if your shoulder's frozen, kind of grab up like this and just start pulling back. This is in kind of the end of the second stage, early third stage. Just trying to start to get some strength back to it if you can. You can kind of pull down and do these guys. We can do internal rotation and just kind of do this, or even make it stretch. So you take this and just kind of pull it out with the other arm, and just gradually stretch. If I'm stretching this, pull and stretch, and if you feel strong, you can kind of pull in and then let it stretch back out. This would be again in the third stage, but this range of motion and rotator cuff pulling outward, this would be one of the last things, but doing these guys is going to be beneficial towards the end of the things. But at the beginning, you definitely just want to let that inflammation settle. Be passive as you can, don't crank on it. Massage deep tissue to these guys is going to be very helpful at all the stages. I would have somebody get in there where you just let your arm hang over the edge of the bed and let somebody dig into those scapular muscles. I would not dig into here and try to do a lot of that until that last stage. Your therapist will probably help you with that. But getting in here and digging in, it can be irritating, and you don't want to increase inflammation in stage 1 and stage 2. All right, that's frozen shoulder, adhesive capsulitis. Hope that helps you. That's a friend of a friend. I don't like to mention names on here, but you know who you are. I'll be sending this to you. Take care and have a good day here from the Philippines.